Thank you, Chairman. Ladies and gentlemen, I have a pleasure to share with you some ideas about communication between professionals. Before I start, I just recalled one personal thing concerning brain drain. It was like maybe 15 years ago when every Estonian high dignity doctor had dream to go to work in Finland. So had I. So what I did, I went to Kajaani, which is not middle of nowhere, but middle in Finland, and got there pretty good proposal to come to work there. So I went back to home and said my wife and children that, well, let's go. And my daughter and son, who were like 10 or 11 years, they said, yes, you can go. Which means that there are some other options also than tele-mentoring and tele-consultation to counteract with brain drain. But what I learned from there, from this time, was that, well, why don't to find the means what could help others who maybe don't have such a strong, maybe family relations or local relations to stay at their home. So I started to work in teleradiology. I'm radiologist by profession, which is a medical photographer, which makes pretty easy to bring images, digital images from Finland actually to Estonia, rather than to go from Estonia to work in middle of Finland. And this idea emerged, so during the last 10 years I've been involved in not only teleradiology but also in telemedicine and different kind of projects. And just to make a remark concerning this morning roundtable, then we have also established after years e-health master's program here in Tallinn. So we have in Tallinn University of Technology. This is you.
Yeah, come on.
I'm sorry for that. Thank you.
Now you can.
Advance. Okay, thanks. It works. So, and I'm also happy to see our students here. We have really 2 years master's program and try to train interpreters between medical staff and IT people. Right, but let's start to discuss about communication. And I think every medical professional knows and actually in daily life feels how important is communication. It might be a little bit underestimated maybe from the not medical stuff point of view, but you have to admit that every contact with a patient makes some hesitation for the medical doctor. And there are quite often situations when either a nurse or physician wants to talk to someone, discuss about the findings, to be sure about the diagnosis or treatment. So communication definitely is one of the main characters of medical professional. Today we are talking telementoring and teleconsultation, which gives additional dimension to communication. However, let's look in general where healthcare is. What are the trends in healthcare today? Just briefly, the content. I will start with strategic options from for communication, then talk a little bit about the background of telementoring and teleconsultation, discuss opportunities, address parties who are involved in, and really try to find, or actually I will make or raise questions, what should we do to benefit from these opportunities. But this is the scheme today in, I would say, in most of Western world healthcare systems, where we have patient, we have GPs, we have other medical specialists, and of course we have hospitals which tend to have a power. So what are the, which kind, if you look from the GP perspective, then what are the options for better professional communication? And for instance, in Estonia, but I'm sure that also in different other countries, the steps are as follows, that GPs tend to merge into the bigger practices. Doing that, they have a mass effect or a scale effect. They could involve also like dentist or some other professional, which gives, of course, more opportunities to this particular GP center, and also for, in a way, a patient visiting the center. And finally, there are already trends that the GP practices are going to be part of the hospital. So it's in most of the industries nowadays that industries, also service industries, are tending to concentrate. For Baltic states, for the Scandinavia, where the areas are quite large, this means that the centers are going more far away from the patient quite often. But then there is an option. There is an option to use ICT tools to do the same what we actually trying to do, merging physically practices. So let's see what happens. I don't have such a nice movie as Alphonsus did, but I tried to move some boxes. So if we merge two GP practices, we usually are moving a little bit far away from patient. And if you add specialists, this is of course good for the quality and the patients who can access this center. But when we go even further on to hospital, then you see the gap between patient and actually the healthcare professional is increasing. So what can we do? What can we do with ICT? Thinking back about communication, then what is communication? It's exchange of information. It's nothing else. A lot of information, of course, is exchanged when you are physically in the same room. However, in healthcare, we can exchange quite substantial amount of information using ICT tools as well. So instead of making distance between healthcare and person bigger, we can connect different parties to the same health information. And even better, we can give also patient or citizen, I would say, similar opportunities. This is clearly, even though it's not our project's scope, this is clearly today's trend, to involve more citizen, to involve more patient into the, not just to be, nice to people, but that they could be a part of the care pathway. I will address this issue a little bit later. Right, another personal experience. It won't be a joke anymore. I'm a radiologist, and I'm still working as a radiologist. I do it in different places, different hospitals or radiology groups. And I give you three examples how, as a radiologist, I could use this health information exchange platform, what is actually functional in Estonia for the benefit of consultation. So today in Estonia we have all digital images accessible throughout the country, so it doesn't matter where I'm physically located. Example one, my good friend works at the island, and he has of course no any X-ray equipment, neither other sophisticated tools. But still he has access to medical images. So how the analog process works is that one refers patient to the X-ray, then patient is imaged, report is written, and then uploaded into the portal. So now to, well, if GP has some hesitation or whatever and wants to consultate, he has to move backwards using exactly the same steps. And you can, of course, you can imagine how long it takes to get some second opinion in analog way. But what we do that he picks up the phone, just tells me where to find the image, and we can discuss based on the shared imaging database. Example two, I report also to GPs, and from my perspective, it's really a good option. Sometimes GP calls me and asks, well, you have written something there. Why don't you just describe me some things in more detail? And again, you see, this is Tele consultation, even though it's not as we think that we have to establish some fancy tools and programs and so on. So more, it's communication using some parts of ICT tools. So again, it brings us closer as GPs and specialists. It gives, I think, for GP kind of additional option to be more confident about the result. Sometimes also he or she can make diagnosis or decision quite more quicker. Third example, I as consultant. I'm working also for a hospital located in West Estonia. And then, well, my main working place is Tallinn, so those poor radiologists who are working outside Tallinn, sorry for them, but sometimes I'm one of them. So, and then I again feel something, you know, there is an accident, car accident. If I'm at hospital, I have always, in Tallinn, I have a chance to call a colleague. Oh, do you think there is a hematoma? Do you think there is, you know, fracture, something urgent, so on? Working alone there, well, hesitation starts. Again, using the platform, just calling to my colleague in Tallinn, well, do you mind to take a look? And well, usually, or no, always, I'm right, but it's good to hear opinion about the of the colleague. But what we have seen also that it's not enough just to exchange data, and this especially concerns to patients. In Estonia, there are 5 years experience now of patient access to data. And what we have seen that less than 5% of people have accessed through internet their data. So why that? Why we don't see boost of looking and searching medical data? And well, according to some research, we can say that there is not enough. If we have data, there should be also information and there should be services, which is actually I would say, the most important thing if we want to benefit from tele-consultation or tele-mentoring. Right, let's move further on. I think we have addressed today several times already that people live longer and there are more chronic conditions, so we need more medical stuff, but unfortunately the number of physicians is not increasing. On the other hand, we also see that there is a so-called Dr. Google, and patients are coming with a great knowledge of their own disease, and we shouldn't pretend that I'm more aware of his or her chronic condition, so than patient himself or herself, because they are every day dealing with their disease. And obviously, this is the opportunity for technology. We have talked here mainly teleconsultation between GP and GP. We shouldn't underestimate GP and other specialist consultation opportunities, but what is coming is physician and patient or citizen consultation, and this will be online, and this will be quite soon our reality. I personally have learned during this project a lot about telementoring, because as we pretty well know, those who are coming from the eastern part of Europe, then in the medical school, the mentoring is not appreciated. Every doctor had to be, champion him or herself and know any other options. So, of course, telementoring between GP and other specialists is obvious thing, and it's very, very valuable and important. And I hope that this project brings, or it has actually brought in this thinking, and I hope this will continue. However, this is I just wrote there on this slide a couple of hours ago that there is a big opportunity to patient-patient mentoring. Just give you an example, what in Scotland is happening. They have found patients or relatives or close people of patients the best helpers for medical stuff. Imagine if one treats father or mother suffering of Alzheimer, like 5 years. This person, quite often being retired, is the real master of Alzheimer disease. Not always medical stuff, but those people who day by day are in close contact with close person with certain chronic disease. To prove this, let's look at parties and what happens in reality in healthcare. Is that this slide comes from Finland actually, and this is calculated based on Finnish population. So what we see there that out of 5.4 million inhabitants, those people who really need active care, they account only 1% of the population. So, and if you look very high risk and high risk patients, then it covers maybe 5%, and we know that we put there 90% of the money. So obviously we need to move or turn the pyramid around and move from highly specialized care and patient-centric teams to more to motivated and supported citizen. And keep in mind, we will have soon a huge fraction of population between 60 to 80. And actually they are very wealthy if they have been living wealthy lives. And this is actually not the burden of the society, but this is clearly a lot of wise people what society could use if they are healthy. So another opportunity. So what could be options and what could be activities what we can do using e-solutions or tele solutions? Of course, to raise awareness, how technology helps to cope with health and care. And we have to address patients. Is it media? I don't know, I'm not sure, at least not yet fully in Estonia, because usually media is looking for blood, not to avoiding blood. Is it stakeholders? I think it should be combination, that the value of the health, not disease, should be a value of society, not just, you know, some e-health funds or health funds or some part, but it should be in the high list of stakeholders. Then, of course, healthcare professionals. I would like stop for a moment at universities and healthcare colleges. I just made a survey a couple of weeks ago concerning Estonian medical education. What do you think, how much e-health or data sharing is covered in medical university or healthcare colleges? How many hours or how many subjects? Zero. Wrong. 0.0001. There are some hours, but you are very right. And for me, for e-health fund, this is really surprise. I thought that, well, this should be everyday working environment, and actually today we underestimate this. Yes, the computer literacy or digital literacy is coming with next generations. This is easy. Everyone knows how to switch on iPad or make PowerPoints. The problem is that the knowledge how to share data, really how to share, how to benefit from shared databases, that the information is integrated and it's accessible and open. This is not the way how medical people are thinking, or at least how they are taught. And of course, they're left continuous medical education, and we need to address societies besides of universities. I personally see that, well, we have seen like Estonian Society of Family Doctors or Association in this project. Really, we see that these are people who could be teachers of colleagues and also patients how to use data. Have I still time? Okay. Then organization. How it works? It works like in healthcare. It works like we saw in this pyramid. We have a lot of hospitals which are actually in sense of data, they are silos. They don't want to share their data. They want to keep their data because information is power. And this is, well, I shouldn't blame anyone because, well, I also would like to have that all Estonian patients would come to me and there is a queue rather than share the information with others. But from the patient perspective, it should be completely vice versa. So obviously what we need in healthcare, and I've learned from Finland and Sweden this clearly, that we should look at the whole care pathway, starting from the home, ending up to really intensive care, not just paying for intensive care and don't bother ourselves with community care or any other not so well paid interventions. And again, involvement of organizations which promote health and pursuing for health, this, we should involve community. It's not, the health is not the business of doctors only. It should be a value of the society. Well, technology is there. Depends on the country. Some countries, well, different countries have different approaches for data sharing and applications. However, if you remember this slide connecting different stakeholders, then what we need are services. Not just connecting, but we need connecting healthcare providers, but provide services. And services are not that we are providing services for doctors. We are providing services for patients. We should focus. We should focus on GPs. We should focus on specialties. We should focus not on patients, but specific patients. So again, the more we involve the person with chronic condition, the better will be service. Here are just a couple of examples. Consultation portals, which, well, technologically should be there, but are not functioning. Or if they are functioning only between some few institutions, not sharing information between larger areas. There are different communication tools, definitely, like decision support softwares, and in the future online communication with citizen. It could be either simultaneous or asynchronous. In this PrimCare project, we have created also standard for the data, or actually data standard for the patients to enter their data through internet, which will be now a new option in the future, hopefully, that before seeing your GP or physician, you can enter your main complaints or write in what kind of non-prescription drugs one has taken before. So to sum up, this is architecture of Estonian e-health system. The state in Estonia has provided us with a secure data exchange layer, which means that, well, the environment is secure. Actually, all the background for data sharing is there. We are lucky also that we have been connected to this data exchange layer. There is a national health information exchange platform or health information system, what is accessible for both for physicians and patients. So actually it should work. But probably what we are missing are, again, specific services up on this platform. consultation portals, decision support, communication with the patient, whatever. So this is the background where we live now. We have two options. We can merge. We can try to put together as many healthcare professionals as possible. This is one option. We can do it vice versa. We can disseminate healthcare professionals and connect them using ICT tool. But actually what I'm pretty sure what will happen is that we will use both. And according to the country and according to the region and maybe according to the power of specific stakeholder. I hope this stakeholder will be, of course, patient. So thank you very much for your attention, and I'm happy to take questions after next presentation.